I'm a Navy corpsman getting out of the Navy on June 25th. I have started applying to colleges for pre-PA programs. What is some advice you would have for me? What job should I have through college? Okay, so first off, hoo-yah, corpsman. That's the rate that I really wanted. In fact, when I joined the Navy, that's the rate that I signed up with. But through a series of events, mainly the ceremonial guard recruiting me, I ended up not being a corpsman. I still had the choice, but that would have added like 6 months to my enlistment, and I was like, no, that's not happening. So I struck yeoman, and I'm pretty glad I did because they ended up sending me to Hawaii. So that was cool. Anyway, just a little bit about my service. But, so you being a corpsman, wanting to become a physician assistant, you're in a kind of a unique situation compared to most folks. Because for you, the patient care experience aspect of these things should not be much of an issue. If you were a corpsman, you were most likely hands-on with patients for the entire time that you were enlisted, which even if you got like an other than honorable and you got out in like 6 months to a year, you probably still have plenty of experience, plenty of hands-on patient care experience to where that should not be a factor for you. The one caveat with that is if they kept you in the clinic and you didn't actually do anything really hands-on with patients, you did clerical stuff, you like did evals, you were essentially a glorified yeoman like me. If you didn't really work with patients a whole lot, then I could see that becoming an issue for you. But if you had any sort of hands-on patient care role, then that should not be an issue for you, and you should not really need many hours. So you're asking me what job you should have. I really would not focus on that. I would focus more on your grades. So what you should really do is get as good of a GPA as possible. Get your prerequisites, get a very high GPA, that kind of thing. That should be your main focus because the patient care experience hours portion of your application is more or less taken care of. Now, all of that being said, you should also still kind of stay in the medical field at least a little tiny bit. So that means maybe volunteering with seniors, maybe drawing blood at like I don't know, like a Red Cross event for blood draws, stuff like that. Do something just to keep your like bedside manner, your hands-on patient care skills, not just kind of from atrophying. Because if you're in college for a year, 2 years, 4 years to get an undergraduate degree, a lot of those skills and those experiences are going to atrophy. So I would really love to see you, okay, my fridge is complaining. I would really love to see you keep your skills sharp and do at least a little bit in medicine, but focus much more on getting your grades solid, becoming a really good applicant. Maybe a little bit of volunteering, maybe a part-time job like once a week, not more than that. But I really wouldn't focus on the work side of things, assuming you have good patient care in your military service. What else should you focus on? Otherwise, not really a whole lot. Honestly, the changing demographics of the pre-PA profession, you know, people trying to get into the profession, it originally was supposed to be for people just like you, for corpsmen, for Army medics, to apply the unique skills that you have, skills and abilities that you have from the battlefield, from military hospitals, to becoming a medical provider. But, you know, over the years, that shifted to the point where now military members or veterans take up less than 4% of applicants, which I think is absolutely insane because we should be treating our veterans well, especially in the profession that was founded for them to apply their unique skills. So more people like you, I'm not going to say the guy's name, but more people like you need to become physician assistants. More corpsmen, more Army medics, more Army, Navy, Air Force nurses. The reason I said no Marine Corps is because Marine Corps uses Navy nurses. Otherwise, I would definitely not be excluding Marine Corps. Okay, Space Force, I don't know what you guys do. You guys are brand new. Coast Guard, I think, also uses Navy. I'm not certain. Don't quote me on that. Anyway, I would love to see more veterans, more Navy corpsmen, more Army medics getting into the PA profession because that's what the profession was founded on, is your experiences, your knowledge. So I hope that answers your question thoroughly. Basically saying the experience portion, the PCE portion should basically be in the bag for you. If it's not, then you're basically like every other applicant. If you were a corpsman that happened to just have clerical duties, not hands-on with patient care, you're essentially like every other applicant and you do need a patient care job, in which case my advice to you would be the same as it would be to anybody else, saying, you know, be a scribe on weekends, be a scribe on nights, just make sure it doesn't impact your GPA. If it's impacting your GPA, just take a gap year, take a half a gap year, whatever, get your experience afterwards. It's not worth killing your GPA just to get patient care experience hours. Okay, so I'm going to say that for the 9th time. If you were a Navy corpsman that was basically just clerical, not hands-on, you're like every other applicant. If you weren't, if you did have hands-on duty, especially like on the battlefield, Bro, you don't need any experience. Don't worry about the job. Just kind of keep your skills sharp in the most minimal way possible, but focus on getting those grades up. And then I'll see you on the other side when you're a PA. Let me know if you need help. Hoo-yah.